When people think of air pollution, they usually picture busy highways, smokestacks, or hazy city skylines. But the most dangerous pollutants aren't always outside. In fact, they're often right inside your home, invisible, odorless, and settling quietly into your lungs and brain without you even knowing. While we worry about outdoor air quality alerts, few of us stop to ask a more intimate question: what is the air like in the room you're sitting in right now? Because for many, especially the elderly, the chronically ill, or anyone who spends long hours indoors, household air pollution may be doing more damage to brain health than traffic fumes ever could. The problem is both simple and insidious. Homes trap pollution. Every time you fry food in oil, light a scented candle, heat up synthetic materials, or use certain cleaning products, you're releasing particles and chemicals into the air. In poorly ventilated spaces, those particles accumulate, and you end up breathing them in for hours, days, years. And the brain, it turns out, doesn't take kindly to this domestic fog. Indoor pollutants such as fine particulate matter, PM2.5, nitrogen dioxide, formaldehyde, and volatile organic compounds, VOCs, can all penetrate deep into the lungs and pass into the bloodstream, eventually reaching the brain. Once there, they may disrupt the blood-brain barrier, spark neuroinflammation, and interfere with the brain's ability to repair itself. Over time, this may lead to memory loss, cognitive decline, mood disorders, and even increase the risk of dementia, particularly in those already vulnerable due to age or existing neurological conditions. The elderly are especially at risk, and not just because of aging biology. Many seniors live in older buildings with poor ventilation, outdated gas stoves, or mold problems. They may use space heaters that release combustion byproducts. They may burn incense or candles for comfort. And they spend more time indoors, especially during bad weather or illness, giving them constant, long-term exposure to low-level toxins that add up over time. The result? A slow, invisible degradation of cognitive function, often misattributed to just getting older. And it's not just homes. Nursing homes, assisted living centers, and hospitals, where ventilation is often poor, air circulation is shared, and cleaning chemicals are used liberally, can also create environments where inhaled neurotoxins accumulate quietly, undermining the very care those institutions are meant to provide. Even everyday kitchen activities can pose surprising risks. Cooking with gas stoves, especially without a proper range hood, releases nitrogen dioxide and fine particles at levels that often exceed EPA outdoor air standards. Yes, your kitchen can legally be more polluted than a Los Angeles freeway during rush hour. And unlike outdoor pollution, there's no app to warn you, no alert on your phone, no public campaign telling you to open a window. In wealthier homes, people install air purifiers, upgrade HVAC systems, or install CO2 sensors. But in low-income households or public housing, none of these precautions are guaranteed. Residents may rely on gas stoves for heat, have windows that barely open, or live with damp, mold-infested walls, all of which silently degrade air quality and slowly chip away at cognitive function. And if you're thinking, well, surely this isn't as bad as pollution from cars or factories, think again. Recent research suggests that indoor pollution can be just as toxic and sometimes worse because people don't realize they're exposed. The damage is cumulative. You might not notice any symptoms after one evening burning candles and cooking dinner with a gas flame. But 10 years of that, in a home with poor air circulation, that's a recipe for slow-motion cognitive erosion. Brain fog, fatigue, irritability, and poor memory, these are some of the first red flags. In younger adults, they might be shrugged off. But in older individuals, they may accelerate the slide toward dementia. And tragically, we often blame the victim. She's just getting forgetful. No one thinks to ask about the air quality in her apartment. So what can we do? The first step is admitting the problem. We need to treat indoor air pollution like a public health emergency, not a side note in wellness blogs. Builders, landlords, and regulators need to prioritize ventilation and filtration, especially in housing for the elderly and medically vulnerable. Families should be educated on how to ventilate kitchens, reduce candle and incense use, and safely use space heaters. And doctors should start screening patients, especially older ones, for environmental exposures at home that could be undermining their cognitive health. Clean indoor air isn't a luxury. It's a basic neurological right. Until we recognize that, we'll keep ignoring the walls around us, even as the toxins inside them quietly take pieces of our minds. You can buy all the brain supplements you want, but if you're breathing in memory-erasing particles every time you make tea or take a nap, you're fighting a battle that vitamins alone can't win. So, open the window. Install that air purifier. Get rid of the cheap candles. Because the path to a sharper mind might not start in your medicine cabinet. It starts in the air you didn't know was hurting you.